This patient was referred to me for endodontic treatment of tooth number 29. This is a virgin tooth, meaning that there are no fillings in this tooth, no decay or what have you. So what's the cause of this periapical relucency that extends coronally? Well, let me tell you. This patient admitted that he used to use this tooth to open beer bottles. So he traumatized this tooth repeatedly. He said at the parties, people just loved the fact that he could open beer bottles with this tooth, with his teeth. So that's why. So basically a necrotic tooth, and you can see this radiolucency that extends coronally from the apical to the coronal. Also, take a look here. This is all inflammatory resorption. Again, the reason for this being trauma to the tooth. And take a look at this now. So that's the tooth here. No cracks. Did not see any cracks. And take a look. A sinus tract right there on the mesial of tooth number 29, between 29 and 28, right here. Okay. Probings, 2 to 4 millimeters all around. And of course, necrotic tooth. So we went over options with the patient, and patient wanted to try to save the tooth. And that's what we did today. Take a look. So 24 millimeters working length I used under surgical operating microscope. Did not see any cracks. The apical diameter was 50. So I went ahead and obturated about 2/3 of the canal with white MTA, WMTA, followed by gutta-perchance sealer, and temporized the tooth and referred the patient back to his dentist. Patient will come back in 6 months for a post-op check, and I'm optimistic. I think this is going to heal, and I had the patient promise me that he would never ever use his teeth to open beer bottles or what have you. By the way, when I first saw this patient for a consult, I did mobility also test, and he had a Miller class 2 mobility as well. So I'm hoping that this periapical relucency will now heal, and the mobility will go back to normal. I was able to clean the that internal inflammatory resorption as well. I used ultrasonics, copious amounts of 6% sodium hypochlorite for irrigation, and of course sonic and ultrasonic activation. So I'll keep you guys posted. When patient returns in 6 months, hopefully he'll come back in 6 months. And I'm hoping that, of course, that sinus tract on the buccal of the tooth will go away within the next couple of weeks. So 1 appointment, endodontic treatment of this traumatized tooth with inflammatory resorption. And of course, you can see that periapical relucency extending coronally and draining through that buccal sinus tract. MTA, gutta-perchance sealer. Remember this patient? I presented this case, I think a couple of weeks ago. Basically, he used to use his teeth, specifically this tooth number 29, to open beer bottles. And this is a virgin tooth. You see, doesn't even have a filling in it, and because of trauma caused the pulp to go necrotic, and actually there is you can see some inflammatory resorption going on as well. Look at this periapical relucency that extended coronally and superiorly. There was a sinus tract right there as well. I'll show it to you. Anyways, Miller class 2 plus mobility, almost Miller class 3 mobility with this tooth also. So of course we discussed options with the patient, and he wanted to try to save the tooth. So we went ahead and did the root canal for him in one appointment. But let me show you so that would be the tooth here, and you can see that was the sinus tract right there, right here. All right. Surprisingly, the probings were all 2 to 4 millimeters, but right there you can see the sinus tract, small partyless and sinus tract on the buccal. So we went ahead and did the root canal for him, and this is immediately after we did the root canal for him. And again, we did it in one appointment. The apical diameter was large, so I went ahead and placed MTA. So this is white MTA followed by gutter per chance sealer, and temporized the tooth. And that was just a few days ago. As you can see, 6/11. Today is 6/18. And I saw him yesterday, so 6/17, which means like 6 days ago. This is basically immediately after we did the root canal. So today's 6/18, so 7 days ago, and I saw him yesterday. So let me show you the 6-day post-op. 6 days, 6 days after we had done the root canal, the tooth had already firmed up significantly. So this is just the x-ray from yesterday. So it would have been the 6-day post-op for the tooth. The tooth had already firmed up significantly. So the mobility was almost normal mobility now. And let me show you. And the other thing that I want to show you is, remember that small buccal parylus and sinus tract? And again, this is just 6 days post-op, completely healed. As you can see, gone completely, healed completely. It's not there anymore. And again, that's the tooth. That's my temporary filling in it. Not there anymore. Healed completely. And that is, where's the date here? That would be the date. All right, they saved this picture today, but I saw him yesterday. So in 6 days, the tooth had already firmed up. 6 days post-op, the tooth had already firmed up, and as you can see, the small buccal parylus and sinus tract is completely healed and gone. And we did that root canal in one appointment. All right, excellent.